This presentation will discuss macro trends affecting the health workforce and projected occupational shortages in the Northern Great Plains region, which consists of Montana, North Dakota, South Dakota, Wyoming, and Nebraska. Changes in agricultural practices, along with rapid improvements in urban transit and regional connectivity, has made urban life even more attractive, causing a decline in rural populations. The decline in population in the Northern Great Plains region has created a provider shortage, causing residents to travel far distances to receive care. As the younger population moves out of the Northern Great Plains region, the older population continues to grow. The increasing elderly population will require more providers to care for them. Rural areas experience greater economic disparities than urban regions. People living in poverty tend to have worse health outcomes because they don't have proper access to nutritious foods or quality care. According to the U.S. Government Accountability Office, Indigenous people die at higher rates than other Americans from conditions that could be mitigated through access to preventative medicine. These people also have experienced long-standing problems accessing healthcare services. In areas without connection to internet or even basic telecommunications, the productivity, efficiency, and quality of care is significantly diminished. Providers have limited access to patients, other practices, or even hospitals in the event of an emergency. The national provider shortage is exacerbated in rural areas such as the Northern Great Plains. To address the provider shortage and improve health outcomes for residents, the Great Plains Health Facility in Nebraska implemented a recruitment and retention strategy in efforts to attract more physicians. The strategy includes improving providers' experience by optimizing the electronic medical record technology, creating partnerships with Kansas State University, Nebraska Medical Center, and Mid-Plains Community College to engage students interested in staying local to practice medicine, and they are also assisting with housing down payments for clinical employees of the Great Plains Health System. Because of the rise in the aging population in the Northern Great Plains, there needs to be a workforce trained and specialized in geriatric medicine. The demand for dietitians is also on the rise. If the population in the Northern Great Plains were to have more access to dietary information, as well as different methods of contacting dietitians, we could see lower rates of obesity, as well as fewer health complications related to poor nutrition and an unbalanced diet. Mobile health clinics are also an opportunity for growth in the medical profession. Utilizing mobile technology could bring necessary services like prenatal care, preventative care, and immunizations to rural communities that lack the resources to obtain them. And finally, public health educators and advocates could improve the overall health outcomes of the Northern Great Plains. By working with underserved groups like indigenous populations, these advocates can ensure that all patients receive the same standard of care.